Let's stay on sort of a medical theme here and learn more about a local woman who became a hospital volunteer inspired by her experience having a non-invasive heart surgery at Legacy Adventist Medical Center here locally. Joining us now, Barbara Wells and her doctor, Dr. Tom Malloy. Barbara, those wonderful, healthy pictures of you there as a volunteer. Take us back and describe for us what sort of symptoms took you to the hospital.
Well, it was late on an evening, and I was having trouble breathing, and I just kind of ignored it for a while, and then started to get a little nervous about it, and so I went online to see what it could be. And after reading that, I decided that I would take myself to the emergency room. And
Dr. Malloy, what was her diagnosis, and then what was the treatment going forward that we described as non-invasive?
Well, I wish it was non-invasive. We call it minimally invasive.
Minimally invasive,
yeah.
Okay.
But she got an ultrasound amongst other studies at Adventist Hospital that showed she had severe mitral insufficiency, which is a leaking of one of the 4 valves of the heart.
And you, for that treatment, did what?
So the first thing was to get some of the fluid out of her lungs. When that valve leaks, the blood that should go out to the body gets back into the lungs and causes the lungs to weep fluid and not oxygenate well. So she presented with a suffocating feeling, couldn't breathe.
Must have been very scary.
it was
Barbara.
kind of what it really was, yes.
Yeah, and so because it was minimally invasive, this procedure you did, was it replacing a valve, taking care of a blockage, or what exactly?
So we actually got her out of heart failure, which is what we call her presentation. And 2 weeks later, I brought her, that's it, we can temporarily keep patients out of heart failure with medication, with a leaking mitral valve. We brought her back to do the minimally invasive valve repair. We prefer to repair valves, and we repaired her valve using robotic-assisted technology.
None of which you knew was happening at the time, probably. You're just like, get me well, right?
That's right, that's right.
So what's really inspiring here, Barbara, is you, through your experiencing there at Adventist, you said, I want to be a volunteer. And how did that come to be?
It was just, I have the time, but it was just the idea that I was treated so well, and we had such a good time, and being in the hospital is not one time that you think you're going to have a good time, and it was just so nice there. I just felt kind of like a family thing.
And what are your duties involved now as a volunteer?
Well, actually, we discharge patients. We deliver flowers. We deliver medications that one department needs right away. We deliver trays to the emergency room from dietary. We walk patients to different places that they don't know.
Providing a lot of comfort that you experienced when you were there at Adventist.
Exactly.
And doctor, it must mean a lot to you to see a patient come back and give back after you restored their life.
So yeah, Barbara was very, very appreciative, and that's what makes our job satisfying. And she was, she was an example of an advance in cardiac surgery that makes a better outcome and shortens recovery. She was discharged, I believe, on the 2nd postoperative day.
Right.
Wow.
And the average length of stay for that procedure is about 7 days. So.
Wow. Well, we thank you both for coming by today, and nice to see you in good health.
Thank you very much.